Hello, welcome to the 2014 version 5.1 HUD Data Standards webinar. I'm your trainer, HMIS System Specialist, Shantae Smith. Though you may hear us refer to these as the 2016 HUD Data Standards, for clarification, these changes are really only a revision of the 2014 HUD Data Standards, version 5.1. We will cover the questions that affect everyone first, then the program-specific changes. If the program changes do not apply to you, then you do not need to watch the entire video. The program-specific changes affect HOPWA, RHY, PATH, and SSVF project types. For further clarification or any questions by any of those project types, please contact us at the HMIS Help Desk. Let's discuss the first change. Gender. There used to be an option for female, male, transgender male to female, transgender female to male, other, and data not collected. The option of other has been removed and replaced with does not identify as male, female, or transgender. The next change you will notice is the question of does the client have a disabling condition? Although the answers have not changed, the requirements have. This question is now required to be collected on all clients. This does include children. The biggest change you will see in this year's data standards is the living situation. This is in reference to your client's residence prior to project entry. The types of residences have now been provided with a header to separate them by category. The first category you will see is a homeless situation, which now includes interim housing. Next, you will see types of an institutional situation, followed by types of a transitional or permanent housing situation, and then you will have the option of client does not know, client refused, and data not collected. Interim housing is not a type of housing, but rather a housing situation where a chronically homeless individual has applied for permanent housing, has been accepted, a unit or voucher for permanent housing has been reserved, but for which there's a situation that prevents them from moving immediately into housing. In such cases where it has been determined to be absolutely necessary that to keep the client engaged in moving towards housing, a temporary solution must be utilized and transitional housing is used. The client should then be identified upon move-in to the permanent house as coming from interim housing. This will enable that individual or household to be identified as chronically homeless at intake for reporting purposes. Please note, this housing is not a substitute for a waiting list or for any situation other than what's been identified here. Next, we will talk about the living situation. We are going to provide you with a few examples of a client entering into a project type coming from a project type. This is because based off of residence prior to project entry and length of stay in previous place, you will then be prompted to answer conditional additional questions. For example, if your client is entering from the emergency shelter, the residence prior to project entry would say emergency shelter, including hotel or motel paid for with emergency shelter voucher. The length of stay in previous place, for this example, it would be 1 week or more, but less than 1 month. Your next question would say, if yes, for client entering from the streets, emergency shelter, or safe haven, the approximate date homelessness started. Then, regardless of where they stayed last night, number of times the client has been on the streets, in emergency shelter, or safe haven in the past 3 years, including today. Lastly, the total number of months homeless on the street, in emergency shelter, or safe haven in the past 3 years. The next example would be if a client is entering into a rapid rehousing project from emergency shelter. Your question for residents prior to project entry would be listed as emergency shelter. The length of stay in previous place in this example would be 1 month or more, but less than 90 days. Then the question, if yes, for client entering from the streets, emergency shelter, or safe haven, approximate date homelessness started. Then, regardless of where they stayed last night, number of times the client has been on the streets, in emergency shelter, or safe haven in the past 3 years, including today. Then, total number of months homeless on the street, in emergency shelter, or safe haven in the past 3 years. The next example would be if your client is entering transitional housing from an institution with more than a 90-day stay. The question, residents prior to project entry, for this example could say foster care home or foster care group home. Then the length of stay in previous place will say 1 year or longer. And then you will see this question, did you stay less than 90 days? As you can tell, it is already populated to no. This is because the length of stay in previous place states that they were there for 1 year or longer. The next question or example is client entering a permanent supportive housing project from a transitional housing project. The residents prior to project entry, transitional housing for homeless persons, including homeless youth. The length of stay in previous place for this example is 2 to 6 nights. Then you will see this question, did you stay less than 7 nights? And just as before, this question will automatically answer itself based off of the answer you provide for length of stay in previous place. Then you have client entering from the streets, emergency shelter, or safe haven. Then, if yes, for client entering from the streets, emergency shelter, or safe haven, the approximate date homelessness started. Then, regardless of where they stayed last night, the number of times the client has been on the streets, in emergency shelter, or safe haven in the past 3 years, including today. And then the total number of months homeless on the street, in emergency shelter, or safe haven in the past 3 years. Next, we would like to show you what this will look like when completing the Maricopa UDE assessment in the system. We do have our mock client data standards. The first question you will see on the Maricopa UDE assessment is the relationship to head of household. You have the option of self, head of household, head of household's child, head of household spouse or partner, head of household's other relation member, other non-relation member, and data not collected. For this case, this is a single, so we will select self, head of household. Then you will be prompted to complete your client's date of birth. After completing your client's full date of birth reported, you will be prompted to complete their date of birth type, followed by your client's primary race and their secondary race if reported, and then your client's ethnicity. Next, you have the question for your client's gender. We do have these options: female, male, transgender male to female, transgender female to male, does not identify as male, female, or transgender, and data not collected. Please note that this is where the change has now been implemented and the option of other has been removed. Then you have the question, does the client have a disabling condition? And please note, this is required for all clients. Next, you have the question, if covered by access, enter in the ID number. This is a text field box. If your client happens to have access or Medicaid coverage, please list their ID number. If you do not have it available at intake, please complete it once it has been made available to you. Next, you have your client's homelessness primary reason. These options have not changed. Finally, we have the residence prior to project entry. This question is, where did your client sleep the night before they entered your project? As described before, we now have headers for each situation. The first situation you will see would be a homeless situation, meaning a place not meant for habitation, emergency shelter including hotel or motel paid for with emergency shelter voucher, safe haven, or interim housing. Next, you have institutional situations, a foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, jail, prison, or juvenile detention facility, long-term care facility or nursing home, a psychiatric hospital or other psychiatric facility, a substance abuse treatment facility or detox center. Then you have transitional and permanent housing situations, such as hotel or motel paid for without emergency shelter voucher, owned by client with no ongoing housing subsidy, owned by client with ongoing housing subsidy, permanent housing for formerly homeless persons, rental by client with no ongoing housing subsidy, rental by client with VASH subsidy, rental by client with GPD TIP subsidy, rental by client with other ongoing housing subsidy, residential project or halfway house with no homeless criteria, staying or living in a family member's room, apartment, or house, staying or living in a friend's room, apartment, or house, transitional housing for homeless persons, including homeless youth, client doesn't know, client refused, and data not collected. For the first example, we are going to select that your client entered your project from a place not meant for habitation. Once you have selected that option, you will now see that the list of questions have changed, and that is based off of their residence prior to project entry. Next, you will be asked their length of stay in previous place. You have 1 night or less, 2 to 6 nights, 1 week or more but less than 1 month, 1 month or more but less than 90 days, 90 days or more but less than 1 year, 1 year or longer, client doesn't know, client refused, data not collected. For this example, your client reports to have been on the streets for exactly 1 year. Then you have this question of the approximate date homelessness started. For this example, 1 year ago today would be 10. Regardless of where they stayed last night, we need to know the number of times the client has been on the streets, emergency shelter, or safe haven in the past 3 years, including today. Your client reports that this has been 1 continuous time of homelessness. Then you have the question, the total number of months homeless on the street, in emergency shelter, or safe haven in the past 3 years. And we will select 12. Next, you will be asked to enter in your client's zip code of last permanent address. If you take your cursor and hover over the question, you will be provided with generic zip codes and cities for Maricopa to use in the event that your client is unable to remember. Please note, we do need the 5-digit zip code. Lastly, you have the question of client location. There is only 1 option, so please select it. Now, the next example would be a residence prior to project entry coming from an institutional situation, such as jail, prison, or juvenile detention facility. Once you have answered that question, the length of stay in previous place, our client reports to be there for 90 days or more. Because he said he was in jail or prison for 90 days or more, the did you stay less than 90 days will automatically populate to no. If they were there less than 90 days, the question would then populate to yes, And then the night before entry, did they stay on the streets, emergency shelter, or safe haven? The last example to show would be coming from a transitional or permanent housing situation, such as a transitional housing for homeless persons. The length of stay in previous place would be more than 90 days, but less than 1 year. And then the response of did you stay less than 7 nights would automatically be changed to no. The next change that you will need to take note of is involving health insurance. There is now a new PIC list value for Indian Health Services Program. In the event that your client receives an other type of health insurance that is not available on this list, please select the option of other and you will be provided with a text field box below to specify what other means. Now onto the project specific questions. For PATH projects only, the income and sources, non-cash benefits, health insurance, and connections with SOAR are now required at entry for all clients served. You will also see a change to your services and referrals PIC list. For HOPWA specific projects, there has been an addition after the T cell, which is the CD4. It will be collected throughout project duration. You will also notice edits have been made for the PIC list of your viral load. The yes/no values have been replaced with undetectable, not available, and available. For SSVF projects, the collection of last grade completed has been added. There are 21 new fields and varying new PIC lists for the homeless prevention project types to be answered on the head of households only. New elements were added for the head of household and adults only to be recorded at entry. The number of visits to an emergency room in the last year, approximate number of nights in jail or prison in the last year, an approximate number of nights in an inpatient medical facility in the last year. For RHY project types, minor changes have only been made to the services and referrals PIC list. Now that we have gone over the critical changes, please refer to the handouts that were provided last week, as well as handouts provided attached to this email. In order to receive credit for watching this webinar on the new data standards, you must take the quiz through SurveyMonkey. The link is listed here and it is also attached in your email. As a resource, please refer to this PowerPoint, your reference sheets, and the HUD Data Standards Manual. For any questions, please contact us at the HMIS Help Desk at 602-908-3605 or email us at hmissupport@cir.org. Thank you so much for joining us, and we will all speak with you soon.